The Sudanese security forces shot and killed 4 protesters on Thursday during demonstrations by tens of thousands of people who defied a security lockdown and severed communications to rally against military rule. For more than 2 months, pro-democracy activists have kept up a campaign of street demonstrations against a military takeover in October. A crackdown on the protests has now seen at least 52 people killed, according to the Independent Doctors Committee, which is part of the pro-democracy movement. On Thursday, security forces killed with live bullets 4 protesters and wounded dozens more. Their plea was posted on social media accounts of Sudanese living abroad, as authorities had severed domestic and international phone lines. Web monitoring group NetBlocks said mobile internet services were also cut. Communications were restored by evening time when the demonstrators had dispersed.
Right, 0.5 ml. Okay, it's the same dosage as the first one.
South Africa, where the Omicron variant was detected in November, said on Thursday that the country's latest coronavirus wave had likely passed its peak without a significant increase in death and that restrictions would be eased. The highly contagious Omicron variant, which contains a number of mutations, has fueled an end-of-year global pandemic resurgence. But mounting evidence, including in South Africa, has given rise to hopes it may be less severe than other strains. Infections dropped by almost 30% last week compared to the preceding 7 days, according to the presidency, while hospital admissions also declined in 8 of the 9 provinces. And finally, a preliminary South African government study published on Thursday showed a booster of the Johnson & Johnson COVID-19 vaccine was 85% effective in preventing hospitalization from the Omicron variant, a finding that helps revive the shot's reputation. The South African Medical Research Council compared 69,000 health workers who received 2 doses of the vaccine based on viral vector technology against a group of people who were unvaccinated. The research, which has not been peer-reviewed, was conducted from November 15th to December 20th, a time when the heavily mutated Omicron variant increased from 82 to 98% of the COVID-19 cases in the country. When a booster shot was given 6 to 9 months after the first dose, vaccine efficacy against hospitalization increased over time from 63% at 0 to 13 days to 85% 1 to 2 months after taking the booster shot.